talk with the New World Medical Streamline and the iStent Infinite. Here I'm just trying to show you when you push down on the trigger of the Streamline how it ejects that viscoelastic laterally from that little metallic tip. And so what I do is we tilt the head and the eye so we can visualize the angle. I start super laterally, and then I'm going to work my way across about 5 clock hours worth of territory, and I'm just going to slowly slide the Streamline along, injecting and putting a little bit of tension on that trabecular meshwork, with the goal of that little metallic tip puncturing through the trabecular meshwork and then doing a little bit of viscocannulostomy to the localized area. This is not something as extensive as an ABIC, which can treat the entire 360 degrees of the angle. This is more of a localized treatment. And so here we can see me working across. There's really not much to see when you do a Streamline. All it's doing is, like we said, injecting that little bit of viscoelastic locally. Sometimes as that metallic tip punctures the TM, you will get a little bit of reflux blood occurring. And we're not going to see that until the very end. I think one of them does end up bleeding a little bit. When I get to the opposite side, I do switch my hand grip on the injector a little bit just to make it easier to push down on the button and hold my place on the trabecular meshwork. So we've treated our entire TM with the Streamline. I'm now bringing in the new iStent Infinite. I'm going to go directly lateral from my incision point. We have 3 little stents we get to inject with this device. So the first one I always put pretty much directly across. Once I've established the placement of the first stent, I then try to look for areas of increased pigmentation that tell me that there's a collector channel nearby. In this specific patient, the TM is pretty evenly pigmented across its entire visible area, and so I'm just going to put these stents as far away from one another as possible. There goes the second one lateral. This last or third stent, we can see a little bit of blood reflux from the Streamline incision point, so I'm going to go just lateral to that so I get a good view and I can make sure this stent goes in the appropriate location. So here I'm just fiddling around trying to give you a good view. We found the spot of our last placement for the stents, and there you can see it. All 3 stents are now in place. We're getting a little bit of blood reflux from that first stent that we put in, but everything looks good. Thank you for taking the time to watch this video.